Welcome back to PT Time with Tim. I'm Dr. Tim, a licensed physical therapist. Today I'll be teaching you the best physical therapy exercises for sciatica back and leg pain. But first, here's my medical disclaimer. Sciatica is really more of a symptom description rather than a diagnosis, and that's because there can be 2 or 3 different causes of this sciatic nerve pain. So if you think about sciatica, it's following the path of the sciatic nerve. So this can include low back pain, buttock pain, kind of back of the thigh pain to the back and outer side of the lower leg. Our first exercise is going to be what's called a pigeon stretch. Now there's a couple different positions you can do the pigeon stretch in. I just happen to start beginners most of the time at the edge of their bed or their couch or a table like this. So if you take that painful side and you bring your leg and turn it outward while you're sitting up on the edge of the table, your other leg is back, and then place both hands in front of that leg. Now, you may already feel a stretch, and you're going to feel the stretch in the buttock area, so kind of in the back and outer side of the hip. So if you feel a good stretch right here, then that's totally fine. Just stop and hold for 30 seconds. Now, if you don't feel a stretch, then I want you to lay your chest down as if you're going to put your chest onto your shin, and this increases the stretch sensation. So maybe you feel a better stretch here. Either way, I want you to stop where you feel kind of a moderate intensity stretch. You're going to stay there for about 30 seconds and do 3 repetitions for the pigeon stretch. Our next stretch is a supine piriformis stretch, and the piriformis is just one of the hip external rotator muscles that's located in the center of the buttock area. So for this stretch, I'm going to take the right foot and place it on the back of my left thigh. I'm going to take both hands, feed them through my legs and around my left thigh where my fingers are interlocked. And then I'm going to take my right elbow and block my right thigh so that it keeps my right knee pointed outwards, and that's really important to do. So I'm going to pull my left knee towards my chest as my right hip externally rotates. And where I'm going to feel the stretch is in the deep center of the buttock area. Now this is pretty much the same area where you'll have that reproduction of pain for those that have sciatica. So you want to be very gentle with this stretch. Only perform the stretch to like a mild intensity. That way you're not actually making your pain worse. You're only feeling the stretch. So hold that for 30 seconds. And do that for 3 repetitions. Our next exercise is a supine knee to chest. And so for this exercise, we're going to lie on our back. I'm going to grab both knees with both of my hands. Now, it's really important to relax the leg muscles, so the arms are going to do all the work. Grab both knees, gently pull both knees in towards your shoulders or your chest areas. I usually say definitely make sure you leave the knees separated, so don't bring them together, but let them fall apart. Pause for about 3 to 5 seconds in this in position, and then relax the knees back out. You're going to repeat that for 15 repetitions. Our next exercise is a prone press up. So for this exercise, you're going to lie on your belly and tuck both arms in next to you, and then you're going to press through your arms and lift your chest up off the table, keeping your hips down against the table. So try to keep the back relaxed as you press through the arms, lifting the chest up. Now, if you don't get much of a stretch with this one, you can actually raise the elbows up to get that full extension. But you're going to repeat this 15 times, just like the prior exercise, the supine knees to chest exercise. And then I want you to compare the amount of pain relief that you get with this one versus the supine knees to chest. Depending on which one gives you the most pain relief, I want you to do that exercise rather than the other one, because they're 2 opposite exercises. One's extension and one's flexion. And you just have to base it on which one gives you the most sciatica pain relief. Our next exercise is a supine hamstring stretch. So I'm going to lie on my back and I'm going to straighten out my left leg because I'm going to stretch my right leg. I'm going to grab and interlock my fingers behind my right leg so that my knee is pointing straight up towards the ceiling. And then I'm going to relax my leg and I'm going to extend the knee. So I'm actively extending my knee like I'm trying to straighten my leg. And then eventually I'm going to feel the stretch on the back side here, even into my calf a little bit. And so I'm gonna go find that mild to moderate intensity stretch, and I'm gonna hold it for about 10 seconds. And then I'm gonna relax and let that knee bend, straightening it back out. And so we'll do this 10 seconds, 10 times. Now, the amount of ankle flexion here matters, because if I pull my toes up towards me, I'm gonna stretch that sciatic nerve even more. And so you just gotta be careful with if it just depending where you feel the most stretch, you want it to be a comfortable level of a stretch. So you can point your toes down, which will give you less intense stretch. Pull them up a little bit, it gives you a little bit more intense. So you just gotta find kind of where it feels good to you. But we're gonna hold it 10 seconds, 10 times. Our next exercise is called nerve flossing. And all that basically means is that we're gonna do some gentle stretching of the sciatic nerve. So in order to do that, we're gonna get into a slump position. So I'm gonna put my hands behind my back. I'm gonna slump down into the slump posture. I'm gonna straighten out my right leg, so my painful side is my right side. And then I'm going to gently pull my foot up towards me until I feel a stretch, basically a reproduction of the pain down the backside of my leg along that sciatic nerve. I'm gonna hold there, so just a mild intensity. That's really important. So don't go hard on this one, but you just want to recreate the symptoms to a mild intensity, pausing for about 5 seconds, and then relaxing the foot. So keeping the knee straight. Again, I'm gonna pull the foot up until I feel a reproduction of that stretch or pain on the backside of the leg, holding for 5 seconds, and then relaxing. So I'm gonna do that 10 times, 5 seconds each. You'll definitely want to go check out my low back pain stretching video next as you continue on your pathway to living a pain-free, active, and adventurous lifestyle. Thanks for stopping by PT Time with Tim, where we restore to explore.